The aim of this introductory video is to show any new patients what they may expect when they have an appointment at Summertown Clinic. The first step is to give us a ring on 01865 558 561 and book an appointment through our receptionists. If you'd like to discuss your problem with a practitioner, we'd be delighted to organise that too, and may be able to give you some helpful advice before you've even come in to see us. Summertown Clinic is located on the Banbury Road, just north of Summertown, next to the Carphone Warehouse on Victoria Road. Our receptionist will welcome you and may ask you to fill a form in. At this point, you should also receive a welcome pack containing some information regarding the clinic and your appointment, if you've not already been sent it. Hello, Mr. Edmund.
Yes.
Hello, Jim. Nice to meet you. I'm your osteopath today. Would you like to come on through?
Yeah, of course.
So, have you seen an osteopath before? Mr. Edmund, how can I help you?
About a week ago, I've started to have this ache and quite a sharp pain.
As part of the case history, we'll ask you a range of questions to get all the information we need to examine you and make an appropriate diagnosis. This may include questions about your overall health, past medical history, prescription medication, and even family history. If you have any documents, such as a doctor's letter or X-ray or scan, please bring them along to show us. After the case history, we go through a series of diagnostic processes to create a working diagnosis. To do this, we invite our patients to undress down to their underwear. However, if this would make you feel uncomfortable, we have gowns and towels on hand, and in some cases we can carry out examinations on patients who would rather not remove any clothing. This is so we can assess the appropriate areas fully and see and feel movement patterns that would otherwise be overlooked. Osteopathic evaluation usually includes looking at your posture, assessing your movement and the function of different joints in your body, and palpating areas of skin to feel tissue texture, temperature and underlying tone. We also use a range of medical examinations to screen for more sinister pathologies, including cardiovascular, neurological, lymphatic, abdominal and respiratory examinations. If at any time we feel uncertain about the diagnosis or require further investigations, we would explain why this is and send you to your GP with a letter detailing what we found, or arrange for you to have a further investigation like an MRI or X-ray privately if required. At the end of the examination, we describe our findings, working diagnosis and how we intend to treat and manage your problem. We welcome questions that you might have and invite you to ask anything that helps clarify things for you. If we believe someone else may be able to better help you than ourselves, we wouldn't hesitate to refer you on, as getting you back to full health is our main objective. Following the diagnosis, we begin treatment. As osteopaths, we use all our experience and skill in providing a patient-focused approach, creating unique treatment plans, depending on different factors, including your age, type of injury, compensations, and we vary your treatment accordingly. So each time we treat you as specifically and purposefully as possible. We welcome questions and often offer explanations as we work, always asking for consent as appropriate, and we ensure you feel safe and listened to throughout. Often at the end of the appointment, we give you advice and exercises to avoid the factors that have led you to having the problem in the first place, and give you exercises to make the most of your treatment and continue the improvement across the week. These are usually simple, effective and few in number, aimed to be appropriate to you and your lifestyle. Where appropriate, we may order supports, insoles or supplements with your agreement to help the process of getting you back to health faster. It's very unusual to require just one treatment. We often need you to come back for a follow-up to ensure we've made appropriate changes and that your improvement is meeting expectations. Your prognosis will depend on a number of factors, and we'll give you an estimate as to the number of visits and sessions you may require when you first visit us. However, it can be difficult to be very accurate at this stage. Each follow-up appointment involves a reassessment to look for the changes we're expecting, and this allows us to appropriately refer you in the very rare instance that things don't progress as expected. I hope this has been insightful and helps remove any uncertainties regarding what it's like to come for osteopathic treatment at Summertown Clinic. If you have any queries or comments, we'd love to hear from you, and we look forward to seeing you soon.